Good evening to one and all. Thank you for joining with us. I would like to welcome you all in today's live Facebook program on NASH and lifestyle modification. I would like to introduce you all our speaker for the day, Dr. Naveen Ganjoo. Sir has done his MBBS, MD Internal Medicine, FMGE Gastro, and Fellowship in Hepatology and Transplant from USA. Sir is a Senior Consultant Hepatology and Transplant from SS Persh Hospital, Bangalore. Dr. Naveen Ganjoo has numerous publications and research papers on his name. And on this note, I would like to hand over the session to Dr. Naveen Ganjoo.
Thank you, Vibhor, and thanks everybody to have me here today. It's a pleasure, and I'm going to talk about NASH and lifestyle modifications today. In a very brief and common language which everybody can understand. We actually very commonly see these reports these days having fatty liver, and we don't know what to do, and we keep running to our doctors and say, oh, I've got fatty liver. So there is some terminology that has been given to these diseases, that is NAFLD or fatty liver disease. You must have heard. So first of all, what is NAFLD? How it leads to liver damage? This is the most important question. What is NAFLD? NAFLD. It is non-alcoholic fatty liver disease. So fatty liver is a silent disease where fat gets accumulated. If you see this picture here, first is fatty liver. In this, the fat accumulates in the liver and it just stays there. So when it stays there, it does not damage the liver initially. It stays there, the liver becomes a little big, and slowly this fat starts damaging the liver and it causes inflammation. Inflammation means it causes the liver to make it angry. So when the inflammation starts, when there is angry, if you have a cut on your hand, there is a lot of fibrosis. You get a fibrous tissue there. That's what happens in the liver. And when this fibrosis increases a lot in the liver, the scar tissue replaces the liver cells and it becomes cirrhosis. The liver becomes small. So when there is fatty liver, the liver becomes big, NASH, fibrosis, and then it becomes small. So accumulation of liver fat in people who drink little or no alcohol. So it is misnomer. Non-alcoholic fatty liver can also happen in people who drink occasionally. Okay, once in a while, once in a month, they are drinking. It is not alcoholic, it is non-alcoholic still. Alcoholic fatty liver is people who binge drink or who have it more than the approved level, that is almost 3 to 4 times a week and in higher doses. This is called non-alcoholic fatty liver disease. Now, what are the symptoms? So this is the biggest problem that we doctors face and even the patients face. So NASH or NAFLD, I told you NAFLD is the first stage, non-alcoholic fatty liver disease. It goes to NASH. What is NASH? NASH is non-alcoholic steatohepatitis. Hepatitis means that there is inflammation in the liver is angry, or there is some damage happening inside the liver. Now this NAFLD and NASH, both are silent diseases. So what do we mean by silent? That means they will not have many symptoms. We will not come to know in the initial stages. Unfortunately, they are so vague that many other diseases can cause these symptoms. Now, if you see fatigue, so weakness or tiredness, by morning you are working, by evening you are tired and you feel a little sleepy and you're not feeling like working, loss of attention, it is so common. Vitamin deficiency can cause it. If you are not eating, diabetes can cause it. So very vague symptom. Some people get a dull aching pain, stretching pain in the upper right side of the abdomen, on the tummy. So why is it? Because the liver is there. When it stretches, the outer capsule of the liver is pain sensitive. When it gets stretched, when the liver is becoming big, it can cause a dull aching pain. It's not generally a sharp pain, it's a dull aching pain. Weight loss and loss of appetite. So of course, so if somebody is losing weight and they're not feeling like eating, there is something not right with them, also can be because of liver disease. Weakness, as I just said, as the day progresses, by evening you're weak, and when this happens, can have many problems. But then all these people who have these issues should be evaluated for fatty liver or they are already progressed to NASH, needs to be seen by their liver doctor or the hepatologist. Now, swelling in the legs. This also happens a little later in the stage when the liver is getting a little weaker and it's not functioning very well. It can cause swelling in the legs. So if any of these symptoms are there, please, you have to get checked if you have fatty liver or you have a non-alcoholic steatohepatitis. And many people come to us, sir, grade 1 fatty liver, grade 2 fatty liver, grade 3, everything is important. You just need to stage, is this fatty liver causing the damage or not? Now, what are the risk factors? Who gets into this? This is very important. There was in Western countries, it's a big problem for a long time now. In India, we are recognizing it more and more. So first risk factor is obesity. So now we are seeing obesity in younger kids, children, and because of lifestyle, COVID, we were sitting at home eating and nothing was going right, no physical activity. These patients are at a higher risk. If you see 50 to 70% of patients who are obese have non-alcoholic fatty liver or NASH. Hypertension, not directly, but indirectly, it does play a part. Diabetes is very important. So obesity, hypertension, diabetes, if you take all these things together, so there's something called metabolic syndrome. So the metabolism of these people is not good. So fatty liver is a part of this metabolic syndrome. In India, it is said if somebody is diagnosed as diabetes, they might have been having this diabetes for 3 to 5 years before now they are getting diagnosed. So that carrying that time when they are not diagnosed or not on treatment, it actually damages the body, liver, kidney, everything. But of course, this comes into a metabolic picture of our body. And if somebody is eating high sugary food, sodas, cold drinks, and soft drinks, all these can damage. High triglyceride and cholesterol, and of course, some medicines. What medicines? Some people are taking non-specific Ayurvedic medications or some homeopathic medications which are not indicated. Most of these medications also, which go through the liver, cause fatty liver and eventually can cause damage. So of course, if there is a fatty liver on the report of your report and you find that you have these symptoms, you have to get your medicine list checked if you're taking medicine for diabetes, obesity, or hypertension or anything, or some Ayurvedic and non-routine medications. You have to get them checked by your doctor saying that is any of these medicines which is causing me fatty liver as well. So that's the most important thing. Now here I have to tell you one thing which is very important, which is not too much written in textbooks. Even NASH or NAFLD can be caused in very lean people. So this lean NASH or NAFLD is very common in India. People are very thin, but because of genetic changes or genes and the diet and lack of activity, they get fatty liver. So it becomes even more difficult to treat. Obese people, you can ask them to lose weight. But when there are NASH in lean people who are not obese, how do you ask them to lose weight? But physical activity comes to play part. So it is also important. It is not necessary it is only in obese people. If there are thin people, lean people, BMI low, still they can get fatty liver. So how do I know I have NAFLD or NASH? So of course you have to go to your doctor, but how do you generally know? Now everybody, if you have these symptoms, you have to get checked and you have to get your routine blood tests done, ultrasounds and everything. So few things in this, if I'm saying, in blood reports when you do your LFT, liver function test, in that there are two tests called AST and ALT, also known as SGPT or SGOT. If these two are higher than normal range is around 40. Okay, actually if you see very strictly it should be less than 30, but even 40 is taken as okay. But if it is more than 40, you may be having fatty liver disease. You need more evaluation. Of course, cholesterol also, if the cholesterol is high, you are diabetic and you have this AST ALT increase, more likely, more chances that you are having fatty liver. Now second thing, fibroscan. If there is a test called fibroscan, before that, if we take ultrasound test, normally you go for an ultrasound and you say, okay, I've done my ultrasound and there is fatty liver. If there is fatty liver, you know, okay, this is the beginning of NAFLD. Now, how do you know you have NASH? One, if AST, ALT is more, And second, there is one more test called fibroscan. So this is also a test which is done like an ultrasound only. It's an easier test to done, not available everywhere, but now of course it is available in most of the cities, which tells you how much hard is your liver. So if the scarring in the liver is increasing and the liver is becoming hard, normally liver is very soft. If it is becoming hard, that means there is a lot of scar tissue which is coming into the liver. It becomes harder. So it comes in kilopascals, and it also tells how much fat is in the liver. That is a fibroscan test. So these things you have to ask your liver doctor. Doctor, can we do these tests to know, do we have NAFLD or am I developing NASH now? It is very important for you to know, because this will progress to cirrhosis. We have to stop this progression. We have to find out now that which stage the patient is in, or the person is in NAFLD or NASH, so that they don't develop cirrhosis, because NAFLD NASH can be reversed if lifestyle changes and other things are done with some medications under the guidance of your doctor. But if it develops to cirrhosis, you can't reverse it. That is irreversible stage. Now, how do we modify with lifestyle modification? What do we do? So the main goal of management of NAFLD or NASH is weight loss. Second is take out the risk factor. If there is obesity, take it out. If there is diabetes, control your diabetes. If there is cholesterol, control your cholesterol, lose weight. That will also help. If you're taking some medicines that can be causing it, you have to take that out as well. So treat the cause. Second, weight loss and physical activity is very important. Of course, in weight loss, modification of diet also comes into play, and physical activity, exercise, of course, it is very, very important. Now, control your weight gain. It is, again, it's a part and parcel of the diet modification, and then eventually when the weight loss happens, it translates into the fat going out, and then it translates into the steatosis decreasing. So steatosis decreasing, and then the fat will go out. So these are the most important things. What is steatosis? The fat in the liver, and steatohepatitis is the fat causing the inflammation in the liver, as I just mentioned. So weight loss has a direct association with decrease in the steatosis or NASH resolution. So if you see, if somebody loses more than 3% of their total body weight, if somebody is 100, if they become 97, that is 35 to 100% of patients will lose steatosis. If inflammation is there, if you lose more than 5%, you lose further, inflammation goes down. If you lose 7%, NASH will become NAFLD. And I'm telling you, this NASH, and you see your reports start getting better. If you don't take any medications, but you lose good amount of weight, 8-10 kgs, or 7 to 10% of your body weight, actually the activity goes down, your AST, ALT comes down, you feel better, your diabetes gets better, cholesterol gets better, and then the liver, the grade of fatty liver on the ultrasound and or your fibroscan starts going down. Again, your balance of activity and food is very important. How many calories are going in, how many calories are going out by your activity is very important. In should be less and out should be more. So that is the deficit. Daily diet should be calorie deficient. So less calories in, more out. Then only you can have an impact on the NAFLD or NASH. Diet mainly which contains high amounts of fresh fruits, vegetables, olive oils, low amount of carbohydrate. These are beneficial in fatty liver. Of course, that's the most important thing. Here is less of carbohydrates, less of sugars, complex sugars, and processed food should not be taken. Tips to help to lose your weight. Of course, keep a healthy routine. One-time eating, timely eating, low-fat diet, walking, fruits, and healthy snacking. Of course, you have to have caution in the portions that you're eating. Of course, these IT and everywhere, including doctors, we have a very sedentary lifestyle. You sit in one place morning till evening, you do your work. But in between, you should take small gaps and you should walk around and you should have some physical activity. Almost 8 to 10,000 steps per day is recommended. And any diet, what you are taking, you should have a focus on that, what kind of diet you are eating. If you have focus on that, then you will know what you're eating and what you should not eat. Don't eat frozen or tinned food because that has lots of processed stuff, preservatives, and lots of sugars in that. So those should not be taken. Adopt a new healthy habits. That's like, walk or bike to work. It's not possible every time, but whenever it is possible, balanced diet and some physical activity, which is very, very important. So exercise promotes well-being, but also a better physique, weight, sugar level, control of diabetes, and also control of cardiovascular risk. So diabetes, cardiovascular risk, NAFLD, NASH is all now, it is taken as metabolic parameters of a body, metabolic syndrome, which is called. Now, NAFLD also might get a new name in the near future, saying that metabolic associated liver disease. So, this, when it happens, because this metabolism, the body is not right and whatever you're eating is not okay, then these things can happen. So, of course, all these exercises, what people do, all of this matters and it counts. To stay fit, WHO says 150 minutes of moderate intensity exercise or 75 minutes of high intensity exercise per week is very important. They have said low intensity is walking or gardening, moderate is swimming, slow jogging or yoga, and high intensity is tennis, cycling, running. So anything which burns more calories in the shorter amount of time, and walking, like say slow intensity workout. So 150 of moderate intensity of workout per week is very important. So what type of exercise we do is also important in this, because the weight loss happens and also the fat or the liver comes out or dissolves finally. So that's about it. These are the basic things that we are talking about NAFLD and NASH. I don't want to go into the details, but this is what we should know. We should get it treated first, pick it up early, treat it by lifestyle modification, and getting in touch with your liver doctor so that they can tell you exactly how you have to do it. Thank you.
Right. Thank you so much, sir, for such a lucid talk. And we have some questions coming up, so I'll take it up one by one, sir. Right. So, sir, the first question is, I am diabetic, but my LFT tests are normal. Can I get NAFLD or NASH?
So, yes, of course. So again, as I told you, diabetic, more chances of you getting NAFLD, NASH. You right now might not be having NASH because your LFT tests are normal. That is, AST, ALT is less than your 35-40 range. Sometimes there are some labs that give range up to 60-70. It is not normal. You have to be careful about that. You can still have NAFLD, that is non-alcoholic fatty liver disease, means there can be fat in your liver, but it has not started damaging your liver yet. Of course, so you need an ultrasound. You might, if ultrasound shows that you have fatty liver, you might need a fibroscan. So of course, yes, you can have it, but most likely you don't have NASH, but you can still have NAFLD. Most of the patients who have diabetes may have NAFLD.
Right. So next question is, can exercise or diet control can alone itself treat my fatty liver, or there is some medication?
So the best medication is what you just mentioned: diet, lifestyle modification, loss of weight, physical activity. These things are the best treatment for NAFLD and NASH. In some cases, resistant cases, or some people who cannot do it because some people who have joint pains, issues, they cannot do it, then medications do come into play. There are nice, good medications to treat this, but treating medications is for short duration. If somebody's liver tests or some NAFLD, NASH is damaging the liver too much, you treat it with the medications, but maintenance and sustenance of this can only happen with physical activity, lifestyle modification, and weight loss.
Sir, another question is whether ALD patients also suffer from fatty liver?
You said ALD, right?
ALD, yes, sir.
Of course, ALD is more reason they suffer with fatty liver, but we are not talking about those patients here. We are talking about NAFLD patients. Of course, alcohol consumption, depending on how much it is one of the commonest causes for fatty liver disease. That is called ALD, alcoholic liver disease, which can have fatty infiltration, and then it causes cirrhosis further on.
The next question. Yeah.
For that, the first treatment is to stop alcohol.
Right. Sir, next question is, what is the ideal replacement for sugar?
Ideal replacement for sugar, is it?
Sugar, yeah.
So frankly speaking, the best replacement for sugar is no sugar. Okay. But if some people want to use it, some people can use the, stevia or something like that for their tea and all that, but it is not advisable in high quantities to use. It's been promoted as make your sweets in this stevia or some alternate forms of it. If it is to be used in smaller quantities, not in very large quantities, but best is to develop a taste without sugar if it is possible.
So another question is, since liver can regenerate itself, should we still treat fatty liver as a major concern?
So because liver can regenerate, what you asked a question was very good. If uh, because liver can regenerate, so if we stop the insult to the liver, that is the fat and the alcohol or diabetes or anything, it will regenerate and get normal. But if we do not treat it or if we do not stop it, the insult will continue and then it will keep damaging. So liver cannot get injured and treat itself by every time. But what you have to do is you have to take the risk factor out and the liver will regenerate. But before it becomes the last stage, which is cirrhosis, after that it doesn't regenerate. So taking off the insult, which you can do by the methods that I just said, only then it will regenerate. That's what we take out the risk factor and it will get better.
Okay. Sir, another question is, do I need to join gym for losing weight?
Of course, gym is important, or it is a good modality. You can use gym, but of course, it's a combination. You need to have a trainer. You need to know what you're doing. You have to have, your cardio exercises and every other things, because physical activity is important. It's not only muscle building. It has to be a combination of both. Can't build your muscles and say, okay, I'm doing my exercise. So it has to be a combination of both. You can do the gymming or jogging outside or swimming or anything. Physical activity is important. Mild, moderate, high intensity, which I just mentioned about. It's not necessary that you have to do gym. Everybody has to go to gym. There are other things also that you can do.
Sir, another question is, how many small meals or snacks can I have in a day?
So it is not about how many, it is about what you are eating. Frankly, if you're eating a small, banana, or you're eating a small portion of cucumber, you can have hourly or second hourly in that fashion. But it depends what you are eating, what way you are eating, and what is the most important thing. Of course, it cannot be that you're eating all the time. Physical activity in between is important, but of course, what you are eating really matters. It's not the frequency per se.
Okay. Sir, another question is, I was diagnosed by grade 2 fatty liver on ultrasound, and I have reduced 5 kgs in last 2 months. My ELT was 80 2 weeks back. How much time will it take to treat fatty liver?
Congratulations, first of all, you are doing a great job. You lost 5 kgs. I know it is very difficult to lose weight. If you've lost 5 kgs and the results actually show in 4 to 6 weeks, sometimes as early as 2 to 3 weeks, but optimally 4 to 6 weeks. Once you start losing weight, because it doesn't happen in one day, it's a continuous process, and the inflammation also gets better in 4 to 6 weeks. So you have to wait 4 to 6 weeks. And of course, in between, don't become lax so that you start eating and you gain weight. So you continue and sustain the weight loss, and 4 to 6 weeks later, you can check and it gets better.
Okay. So we'll take one more question, since you have already addressed this question, but for the betterment of the larger group, we'll ask it once again. Sir, what are the tests that is to be conducted to know if a person have NAFLD?
Okay, so if a person has NAFLD, first of all, it is ultrasound, which will say that you have got fatty liver. Second is, then you do liver function test. You see the AST, ALT, and you can go to fibroscan and see if this fat, which is accumulated in the liver, but NAFLD already there, is it causing NASH? That means is it causing damage in the liver? So ultrasound, blood test, and fibroscan. These three are the important things. Of course, there are some scores which you can do all online by blood test, but these are the major tests that you need to do.
Right. Sir, we'll take last question. So the question is fatty liver gender specific?
So fatty liver is gender specific, no per se. It's seen more in males. There is some genetic preponderance more in males. Females have less fatty liver, but of course they also do have fatty liver. More importantly, our lifestyle, because it's more sedentary, females work more at home and otherwise, whatever is our culture that happens. And second, most importantly, what we have to keep in mind is alcohol, diabetes, because males are more, I would say, have more diabetes. And at an early age, sometimes if it's genetic preponderance, what will happen is they will develop more fatty liver. So all looking at perspective, all of this together, yes, males do have more chances of getting fatty liver than females.
Right. Thank you so much, sir, for addressing all possible queries and for such an interactive and wonderful session, sir. I'm sure after this session, patients who are having fatty liver or their caregivers, it would be very helpful for them, this session. And I would also like to thank our participants for joining us and being an active participants. And to know more on liver health, fatty liver, NAFLD, NASH, do like and follow our page, NASH 24/7. Thank you all. Thank you so much, sir.
Thanks a lot.
Thank you.
Thanks to all of you, and thanks for having me. It was a good talk and good interactive session, of course. Thank you.